Hi, good evening. Austin Mayor Steve Adler. You got a minute? So we're going to go through some numbers tonight. The normal dashboards aren't up because the back end is being worked on, but I have the numbers for you tonight, and they're significant. So we'll cover those. Today's the day when Dr. Escott and Director Hayden make their presentation to the City Council and to the Commissioner's Court. So the bulk of what we're going to go through is that normal once a week slides from Dr. Escott. And I don't know how to turn that off. There, hope that works. We'll go through those. Dr. Escott's slides, and that's pretty much what we'll do. Tonight. So, if you were to look at the dashboard this evening, and would go to take a look at the key indicators, you would find an announcement that the dashboard's not being updated today on the 12th due to software upgrades. But this is the dashboard that you would see. These are yesterday's numbers. Let me tell you what today's numbers are. This number here, the new cases yesterday, the 955, was really 2 days worth of numbers. Remember that Sunday we didn't enter numbers because of the ice and the like. So that meant that over the last 2 days, we had average Saturday and Sunday then, averaged about 400 or Sunday, Monday, we had averaged about 477, 478, which was below the 7-day moving average. I said that was a good sign, but numbers always go down on weekends because who wants to go get tested or just on weekends? Sometimes you see a little bit lower number. The number for today is 716. Which is substantially above our 7-day moving average. So it's disappointing to see that number's coming in higher. Confirmed new admissions. We were down at 54. This is the number that really does show a reduced number on a Sunday. Because people don't like going into the hospital on Sunday. They're with their family. They say we'll go into the hospital tomorrow on Monday. Number of people that went into the hospital, the number here, new admissions for tonight, is 80. Higher number, below the 7-day moving average of 87, but obviously much higher than the 54 number. Positivity in the city, we'll talk about that in a second. The number has gone down, but that might be more a function of we've given more tests. Went from about 19,000 tests to about 22,000 tests this week. But we'll talk about that in a second when we go through Dr. Escott's slides. Let's take a look at the other dashboard. And we'll talk about the numbers that exist for this evening. Let me see if I can find this dashboard. Here it is again, not being updated if you were to go live to the website, but we know the numbers here. Number of people hospitalized yesterday was 564. Today that number is 601. That's a total number of COVID patients. The 7-day running average yesterday was 573, so still above the 7-day moving average, 601 higher than the 564. Number of people in our ICUs yesterday was 180. The 7-day moving average yesterday was 166. Tonight, 190 people in our ICUs, near all the capacity we could do with the pre-existing staffing. Looks like we're getting a little bit more staffing in, so our numbers are getting extended there a little bit. That's one of the reasons why we're opening up the alternate care site, so that we can staff that with people outside of our system. The state's bringing in that staff. Thank you, state. And that will allow our hospitals to send some of their lower acuity patients, thus freeing up space and staff to increase their surge capability in the hospitals. Number of people on ventilators tonight Yesterday it was 106. That was the 7-day moving average. The number tonight is 104. We had 37 more admissions than we had discharges, which is why the number of people hospitalized has gone up over 600 to 601. So yesterday we had talked about the possibility that the numbers were leveling off. Those, I think, were the weekend numbers. So we're not seeing quite the indication of that today. But this is the week when we would begin to see that kind of indication if we had a behavior change, probably toward the end of this week. So let's see what the numbers look like here as we move away from the weekend and as we get that additional time away. Let's take a look at Dr. Escott's slides, his presentation. A lot of data here for people that like looking at slides. We're going to share these now. See if we can get these up for you. These are Dr. Escott's slides. Loading. This is his first slide, shows us new confirmed cases. You can see the number continuing to go up over as we see the numbers. That's the 900 number that gets divided in half. But here tonight, just on its own, we're about here with the 700 number, still on that increasing plane. This is the chart that has new admissions. You can see the yellow line, which is the 7-day moving average, came down yesterday as the number went down. This time the number that's not published tonight probably takes us back up to this area. Again, still the incline, more than what we were seeing in the summer when we were able to dodge that bullet. Here on one chart is hospitalizations and ICU admissions and ventilator use, all of them continuing to track up. The dotted line is the 7-day moving average. The more irregular line is the actual numbers, again confirming that we are still in a rise of this virus, not only in Austin but around the state. As you recall, we showed this before. These are the 22 regions, which is how the state's broken up for something like this pandemic. Austin is region O, that's in the middle. A couple months ago, governor said if any of these regions go over a 15% occupancy for COVID, that's a really dangerous situation. So he would move back occupancy at restaurants and retail from 75% down to 50%. He would close bars in those counties where bars are open, which is not Travis County, but I think it is Williamson County. Austin, Travis County did not open bars, except for those bars that are masquerading as restaurants under the loophole that the governor had created. Also telling hospitals not to allow any elective surgeries to come in. As you can see, since then, almost all of the regions in the state have now qualified, gone over 15%. Many of the large cities that a number beyond us, but here this weekend, Austin went above 15%, and I think we're just between 17 and 18%, with a number that's still heading up. This is our hospitalizations by age group, and you can see it's broken into 3 clumps. Here are 4 lines here, and they correspond to people over 80, between 70 and 79, between 60 and 69, and 50 and 59. All 4 of them are in this area. That's the greatest percentage of the people that are showing up with new cases. But in the next group, the group that is 40 to 49, that's green, the blue is 30 to 39, and the orange is 20 to 29, or yellow, 20 to 29. They're all here. That's over 10%, just below 10%, over 5%. So 25% of the people that are representing new cases are in that middle-aged group. And the cases are so severe that they're ending up in our hospitals. Only down in this range, which are the folks from 10 to 19 and 1 to 9 and newborns, do you get down to this low number. The 10 to 19 is the gray line. We're seeing more of those associated with school. We'll talk about those in just a second. And certainly those folks, even if they don't suffer severe consequences, can pass the virus on to others. This is hospitalizations by race and ethnicity. You can see the blue line is white, not Hispanic. The green line is Latino. And you can see that number, that's Hispanic, all races, had gotten up pretty high, started to come down, went up. Right now, the number is, I think, 39.4, which is about 3% higher than its percentage, that demographic percentage in the population. This group here, African American, Black, not Hispanic, the number at about 12%, about 50% higher than what that race demographic is in our city. This is positivity. On the dashboard yesterday, it registered at 17.9. It's gone down to 16.6. Ordinarily, that would be really good news as the positivity went down. You can see really good news is if we were to get back to where we were during week 43 and 44 before the numbers started rising. But this is a good direction to move, but I think that may be just an anomaly, may not be real good evidence of what's happening in the community. If you take, and we'll get to that here in just a second. Let me see if I have that chart, and it doesn't look like I do. But what we know in terms of this is that the number of people in each of the age groups that are dealing with this, and in the races that we're dealing with, even though the positivity level has gone down, which is a good thing, the number of people in the group of Hispanic is larger today than it was last week. So the number of people infected in these different populations, generally speaking, is a larger number, even if the percentage of those people as a function of the total number of tests given has gone down. And I said earlier, we've gone from about 19,000 tests the prior week to over 22,000 tests this past week. So the overall positivity has gone down. The number of cases has gone up, and the number has gone up to a lower degree than the number of new tests, which is why positivity has gone down. In other words, it's a number that's headed in the direction we would want to see it, but maybe not for the reasons that we would like to see it, going from 17.9 to 16.6. That's reflected again here this week. The positivity rate, Hispanic, Latino, still incredibly high, way over 20%. Hawaiian, other Pacific Islander, over 20%. The Black or African American, just under 20%. White, over 10%. Numbers a little bit lower than they were last week, but more cases and a function of larger number of tests that are given. This is age group, and you can see again that The groups with the greatest positivity, over 80, but also 40 to 59 in terms of positivity. Not always the case. It had been where the older folks, a greater positivity rating. But now this kind of middle-aged group is coming on strong, and here is 10 to 19 positivity rate, over 20%, as we saw before. Dr. Escott says that they're seeing some kind of clustering in our schools, mostly with respect to extracurricular activities, seeing it with boys and girls, basketball, also seeing some clusters associated with shared transportation.
That's the graph we're seeing.
So Diane tells me that you're not seeing the graphs as we change the pages as I've been going through them. Let me see if I can fix that, because when I'm sharing this with you, I can't see the pages. So let's try this again. Let me so let's see here. Do you see something past the first line? That's good. You see me. Let's see if we can share the screen, get to the Chrome tab, get to the Google Drive. Let's see if we can share it.
Somebody said it's okay to post it later.
We may have to post this later.
It's still the same graph it was there before.
So let's see if let's see here if we can get to a different graph. Usually takes just a moment for the graph changes to take place. Let's see if we get to the map with the X's. Doesn't look like it.
Somebody said to open it with Google Slides.
Somebody is suggesting we open it with Google Slides. Let's see if we can try this one more time, and then we'll let everybody
Somebody
go.
said at 10 minutes, probably we ought to have the technology down for now.
Let's see here. Let's see if we can share the screen. Let's get to this. Let's open here and see if we get to that.
We have the original slide.
What if we went there? Do we see a change now? All right, we may just have to get these slides.
You can post them.
Up to you. We'll post them to you later.
Wait, there it is.
All right, so I think when I head over, we lose it. So this was the slide that we had. We'll do this real fast. 7-day moving average of new cases. Let's see if this comes up on the board. There it is. 7-day new slide, new cases. This was the one that gave us the new admissions. The blue line moving over is the actual number. The yellow line is the 7-day moving average. This is the chart that gives us both hospitalizations and ICUs and ventilators. You can see those numbers all still going up. This was the chart that I talked about at length concerning the regions in the city. Austin, Region O, everybody over 15%, including the city of Austin now. And that means that by the governor's order, retail restaurants go from 75% to 50% occupancy, no elective surgeries. Bars have to close in surrounding counties where they've been allowed to be open. Just shows you that it's just not us, it's happening all over the state. This is the chart that I talked about where you were looking at hospitalizations by age group. These are the four oldest 10-year periods in our city, over 80 in the 70s, in the 60s, and in the 50s, all up here. But even in this group, which is people that are in their 40s and 30s and 20s, you still have 25% of our hospital admissions that are happening. So it's certainly impacting everybody. This was the chart showing the hospitalization by race and ethnicity. The blue line at the top is white community. The green line is the Hispanic, all races. Number just below 40%. I think it's 39 and change, about 3% higher than demographic. African American at about 12. Is about 50% higher than its demographic. This is positivity that we talked about at length, number going up over time. Last week 17.9, this week 16.6, and that is a number that is down. But yet the total number of people with new cases has gone up. But the positivity went down. It looks like this number's gone down perhaps because we had a burst of new tests. Went from 19,000 to a little over 22,000. So it may not be that the virus has spread any less because we have more cases. We just have more testing. So we're going to have to see what happens here over the next week. This is the chart that shows us by week, the last 4 weeks, showing us positivity by race. And you can see this is Hispanic Latino in the mid-20s, way too high. Native American out of the Pacific Island, over 20%. Black, African American, nearing 20%. The orange is other, but purple is white, and that's significantly over 10%. This is by age group in each of the last 5 weeks. What's significant here, you have high positivity, as you might imagine, among some of the older folks, but also this one here. This is the 10 to 19 age group. And I was talking about what was happening in our schools. We're seeing clusters, extracurricular activities out of school, after school. What we're seeing is an increased number in girls and boys basketball. Also in transportation, shared riding on buses or the like. This is positivity in school-age children from January 2nd to January 9th. High school, 20.2%. Middle school, 27.1%. Elementary school, almost 20%. Preschool, 10%. This is why Dr. Escott was recommending to schools and to parents that they keep their children home and do virtual education to the greatest extent that is possible. We know that the school district, for financial and other reasons, is having to keep schools open. But at the same time, it's certainly encouraging people to participate virtually. That's what Dr. Escott recommends that your choice be. As family members, to the degree that you're able to do that. This, by the way, is cases this past week from 1/4 to 1/10, 292 cases. This shows you new cases by district. Austin ISD, 46 student cases, 133 staff cases in our area. Those are the numbers. Those are the numbers this week. Still at a period of time where we're seeing increased infection in our city. Everybody still needs to really double redouble, triple the efforts to wear your mask, social distance, and stay away from large groups. Because we know that's not going to be necessarily sufficient, we have to do other things. I want to thank the state for providing us a regional infusion center. Both the staffing for it and the trailer that is the physical ability, a turn capacity of 26 a day, although that staff's a pretty clever, innovative group, and they're doubling that capacity. This infusion center is a place where you can go to get one of the therapeutics or treatments that President Trump got when he went to Walter Reed Hospital. It's available for people in our city. Primarily folks over 65 that get the virus. Check with your physician or your clinic. If you get a call from Austin Public Health offering you this opportunity, you should take it. It is free. You don't have to pay for it. It's not something that's just available for presidents anymore. It is something that for people who get the virus frequently, it can shorten the period of time that you're going to be dealing with it to lower, in many cases, the severity that people have to deal with. So we appreciate the state's assistance on that. We are also opening the Austin Travis County Alternate Care site in the Austin Convention Center. That is also serving as an additional infusion site. Again, we thank the state for giving us the staffing for this. Staffing is the key issue. That's our limitation in ICUs and in our hospitals. So by having the ability to do infusions not in hospitals, by having the alternate care site available to us, we're able to open up space in the hospital. We take the lower acuity patients, the ones that don't have the serious kinds of cases. We can move them to this alternate care site. And what that does is it frees up then the bed space, most importantly, the nurses and the tech folks in the hospitals, so that they can deal with the next level higher of acuity, so that those nurses and attendants can deal with the next level of acuity, and hopefully create some additional surge capacity in our hospitals, which we need, given that we have 190 people in our ICUs tonight. And for planning purposes, we were using 200 as the number that we could staff with existing staff. Again, we have some additional staff coming in, which gives us a little bit more surge capability. This alternate care facility was opened today and is now receiving patients. The hospitals requested that we do this in support of their operation, and we need to do everything that we can. You can't show up and go to this. You have to be referred by the hospitals. And they're only sent here if they're determined to be stable and able to be transferred. It's low acuity, moderate acuity patients. I want to remind you, we are in stage 5. We have to do everything we can to dampen this surge. If we can do this one last surge, then I think we're going to start seeing the benefit of vaccines being given throughout our city and county. Wear your mask whenever you're around anybody that's not in your household unit. Try to minimize, if you have at all any incidents where you're around other people and you take your mask off. Don't eat with people that are not in your household group unless you're really far and distant from them. Masks. No gatherings with anyone outside your household. Dining and shopping limited just to essential trips. Avoid non-essential travel. And businesses, please operate, if you can, through contactless options like curbside delivery. And please, everybody, let's help these businesses survive by buying gift cards and takeout meals and everything we can to try to help them. We delivered vaccines. We've talked about that the last couple of days. Judge Brown led us through a great pilot exercise with Constable George Morales on Saturday. Got like 635 people vaccinated over on the east side in Precinct 4. Austin Public Health is in their second day. They did between 800 and 900, like about 850 vaccinations yesterday at the Delco Center. That's giving tests to people that are most susceptible. A lot of the community care and People's Clinic and Lone Star clients, but also others as we reach out, doing this on the east side. Focusing on equity, focusing on populations disproportionately affected, those of color, living in poverty, living in geographic areas where the disease transmission is highest, those without transportation and access. We want to get that universe testing. Went on today as well. I haven't heard the numbers today from the testing. It'll go on there Wednesday through Saturday. But look online, because tomorrow Austin Public Health will be launching its sign up for people. Hopefully people primarily over 65 now, so that you can go and get the test. This is Austin Public Health. If you have access to this test otherwise through your physician or your doctor or your practice, please do that and leave these spaces open to the folks that really need to get it through Austin Public Health. But it's a place for people to be able to sign up and just get yourself a time. In addition to Delco, they're opening up 3 other areas, one up near Pflugerville, one in Dove Springs area, and one at Gus Garcia, I think. But you have the ability to be able to sign up. I will tell you that not everybody who wants to sign up can. We have a couple 100,000 people in this city that are over 65 or have a illness that makes them a great candidate. A couple 100,000, and all we have in tests this week is 12,000. And 600 of them were delivered on Saturday, just under 1,000 yesterday. It'll be just over 1,000 today. So you're talking about 9,000 tests being given for people who start signing up tomorrow. The sign up is going to fill up really quickly. Other cities have seen it fill up within a matter of minutes. But the state, we hope, will see that we're able to deliver large quantities of tests in an equitable, fair way to those folks that need it the most, and will continue to give us an ever-increasing number of tests. So if you don't sign up and get a place this week, you'll be able to keep trying. My hope is that we can get through most of this group here over the coming weeks, certainly within the next couple months. So we ask of everybody to be patient, but to participate. You'll sign up for here the same way you were signing up for tests with Austin Public Health. If you don't have the computer access to be able to sign up for tests, please know that you can call 311. And you'll be able to participate in the process just using phones. We're asking for more and more doses. There's one scenario that has us getting 30,000 doses and then increasing the geographic area that we're trying to get into. Not only are we going to be doing this at locations, we're also going to be delivering it to people that are homebound, also putting vaccines in a mobile facility that can go out to those areas that are transportation challenged. Those are all the numbers that we have. Those are Dr. Escott's numbers. Want everybody to know we are appreciative of the state giving us the vaccines this week of 12,000. Thank you. Thank you to the governor and the state for the infusion center and staffing, for the alternate care site and staffing associated with that. This is the kind of thing we need to do to get better long-term. Short-term, we need to do something about this spike. We have one of the lowest mortality rates of cities anywhere in the country, but we're being tested right now. We really need to turn that curve if we're going to keep our neighbors alive. I don't know if I said this incorrectly earlier, but on Wednesday, you get to go in and sign up for a vaccine. It's using the same system that we used for testing, but it'll be vaccines. Once we get through the folks over 65, I think we're anticipating that in the spring we'll be just opening it up generally to everybody. And my hope is that by the end of the spring, as we're just beginning to enter in the summer, everyone in our community that wants the vaccine will have had a chance to get it. And on that positive note, I want to say good night. You all take care and be safe.